We continue our coronavirus coverage now. The number of people infected in Connecticut has jumped once again. At last check, Governor Ned Lamont says there are now almost 1,300 cases in our state. So far, 27 people have died. And this morning, we know that Torrington has confirmed their first COVID-19 death. Officials say it was an elderly adult, but have not released any more information than that. And the Department of Corrections has also confirmed a third employee has tested positive. Officials say the employee was assigned to the Hartford Correctional Center and tested positive after working a detail at Manchester Memorial Hospital. Continuing our team coverage, medical experts are projecting the number of people infected will peak the second week of April, and the race is on to be able to meet the demand when it hits. Channel 3 Eyewitness News reporter Carolina Cruz is live from Yale New Haven Hospital. And Carolina, how are they doing over there with their supplies?
Well, we know that the swabs to test people here at Yale New Haven Hospital are running low. So right now, medical staff are priority across our state for testing because they are the ones that are most exposed. However, that lack of testing is impacting our state's ability to gauge or have a better idea of just how many people have contracted COVID-19 in our state. In the meantime, we know that medical staff in hospitals across our state are awaiting for more PPE or personal protective equipment. More thermometers are expected next week for hospitals, but the surgical gowns are going to be delayed until late at the end of the month. The state has fewer than 1,000 ventilators. We know that state officials aren't saying just how many more we need in a worst case scenario, but they ordered 1,500 more. Meanwhile, doctors at Yale New Haven Health are preparing for when supplies run even lower. The hospital is saving and planning on possibly repurposing and reusing the in-demand N95 mask. Researchers are testing their effectiveness and the safety too.
Right now, don't have any plans to use those, but we're holding them in reserve in case we find ourselves in a position where those are our best choice for use.
Right now, about 15% of hospital beds have been filled up by people with COVID-19 or who are awaiting their results. And so hospital space is going to become limited in the coming weeks. We know that dorms could be turned into hospital space. Here at Yale New Haven Health, we know that 152 patients have been hospitalized with coronavirus, and a third of them are in the intensive care unit. So again, dorms or other spaces could end up being more hospital space for folks here. For now, reporting in New Haven, I'm Carolina Cruz, Channel 3 Eyewitness News.